While the following segments may be less visually stimulating, we feel that covering the logistics of loading and deploying the endoclip is an important part of this training video. These segments are probably best viewed with the clip loading equipment in hand. In the following sections, we will display the endoclip and demonstrate use of the reusable and disposable clip fixing devices. We hope to increase the viewer's familiarity and comfort with this equipment. The endoclip is a non-magnetic derivative of stainless steel containing iron, nickel, and chromium. The manufacturer recommends avoiding MRI in patients with clips. An ex vivo experiment published in Progress of Digestive Endoscopy in 1997 demonstrated that there was no displacement of clips or tissue damage to beef flesh following 1 hour of MR scanning. There was, however, some image artifact. There are no known adverse events for patients who have undergone MRI who have endoclips in place. Loadable clips manufactured by Olympus Corporation come with different length prongs ranging from 4 to 8 millimeters and varying angle of prong tips, right angle or obtuse. We use the long clips for most applications because they can grasp more tissue. This is a close-up view of the long clip with right angle prong tip. The clip connector will attach to the hook on the clip fixing device. The spring loop will be retracted after the clip is exposed prior to deploying to fully open the clip prongs. When fully open, the span between the prongs is 12 millimeters for the long clip. Once deployed, the length of the long clip is 12 millimeters also. For the standard clip, the clip prong span is 6 to 7 millimeters and the deployed length is 1 centimeter. Clip fixing devices are available for upper and lower endoscopes. They require an endoscope with a minimal working channel diameter of 2.8 millimeters. There are reusable clip fixing devices. These are designed to be used with sterile clips that are loaded by the operator prior to each use. There are also disposable clip fixing devices that come preloaded with a clip for single use. We recommend the reusable device because it is less expensive and allows flexibility in choosing the size and shape of the clip to be used. We will now demonstrate using the clip devices. To load the clip, start by sliding the tube joint toward the handle ring until a click is heard. This will expose the coil sheath from the tube sheath. Depress the green ratchet release button to push the slider away from the handle ring. This will expose the operation wire with the hook from the coil sheath. This is a close-up of the operation wire with the hook for mounting the clip connector. The clip is then mounted on the hook. The operation wire is retracted into the coil sheath by pressing the green ratchet release button and partially withdrawing the slider until the clip pipe fits into the end of the coil sheath. Note that further retraction of the slider will prematurely retract the spring loop and widen the clip prongs. This should be avoided. To pull the clip into the tube sheath, advance the tube joint away from the handle ring. This will close the clip prongs. Hold the apparatus near the tip to avoid bending the clip while inserting into the working channel of the endoscope. Advance the tip of the clip fixing device out of the end of the endoscope. To expose the clip from the tube sheath, pull the tube joint toward the handle ring until it clicks and locks. This does not require depressing the black release button. The clip can then be rotated into a desired position by spinning the red wheel either in a clockwise or counterclockwise fashion. There is a slight delay between the movement at the red wheel and movement of the clip. To retract the spring loop and fully open the clip prongs, pull the slider carefully toward the handle ring. Look for the prongs to widen and the spring loop to disappear from view. If the slider is pulled too close to the handle ring, the clip will become prematurely deployed. To deploy the clip, pull the slider toward the handle ring until the clip is closed and released. We will now demonstrate the single-use disposable device. The device comes ready to load into the endoscope working channel. Once the tip of the device is exposed from the endoscope, remove the red plastic tab. Next, slide the yellow plastic piece toward the handle to expose the clip. The clip prongs are maximally opened by pulling the slider toward the handle ring. Again, you must be careful not to move the slider too far and prematurely deploy the clip. To deploy the clip, pull the slider toward the handle ring until the prongs are closed and the clip is released. The disposable clip applicator cannot be reused.